Welcome back to another eye-opening episode of Coup Save America, where we dissect the issues plaguing our nation and advocate for change. I'm your host, Sean St. Hart, and today we're shining a spotlight on a situation that is more than just a statistic. It's a matter of life and death, America's healthcare crisis. If you are at all familiar with this show, you know that I can normally rant on for hours about the state of healthcare in our great nation. But this episode's monologue will be considerably abbreviated due to health concerns of my own. Folks, I finally caught COVID-19. Fortunately, I recovered enough to perform in my role as host for this, our first live episode of 2024, but I still suffer from a lingering brain fog and I'm having trouble concentrating on tasks that normally require a great deal of focus. I also tend to have a coughing fit that tends to rise up every now and then at very inconvenient times, so please forgive me if I might switch my mic off occasionally during this episode. But that's enough whining about my own poor health. It's time to tackle the broader problem of nationwide healthcare shortcomings. Picture this. In the land of the free and home of the brave, millions of our fellow Americans are without the safety net of health insurance. And for those lucky enough to have coverage, many are underinsured, forced to navigate a maze of deductibles, copays, and denied claims just to stay healthy. It's a travesty that's leaving our most vulnerable citizens behind. Today, in the United States, a staggering 112 million Americans, approximately 44% of the adult population, find themselves grappling with the burdensome challenge of affording the medical care they need. Imagine that, nearly half of our nation's adults facing a daunting struggle to access health care. And it doesn't end there. The share of adults forced to forego necessary medical treatment due to financial constraints has tripled, now standing at a staggering 30%. Now, let's talk about the grim reality of the COVID-19 pandemic. Over 1/3 of all COVID-19 deaths and a troubling 40% of infections in the United States have been attributed to a stark lack of health insurance. Our nation's life expectancy has plummeted, hitting a disheartening low of 76.4 years, the lowest recorded since at least 1997. Let's talk about our seniors, the backbone of our society. Far too many are rationing their medications, splitting pills in half or skipping doses altogether because they can't afford the skyrocketing cost of prescription drugs. And it's not only seniors. Families across the country are faced with impossible choices, forced to forego necessary health care or risk drowning in medical debt. Here's the truly alarming part. Despite being the only major country on earth without a universal healthcare guarantee, we find ourselves spending twice as much per capita on healthcare compared to nearly every other nation. Take a moment to let that sink in. We shell out nearly $13,000 per capita on healthcare, while countries like the United Kingdom, Canada, France, and Germany spend significantly less while providing universal coverage to all their citizens. According to a study published in the American Journal of Public Health, medical debt is the number one cause of bankruptcies in America. Let that sink in for a moment. Families driven to financial ruin simply because they had the audacity to get sick or injured. It's a cruel irony in the wealthiest nation on earth, where profits are prioritized over people and human lives are reduced to bargaining chips in the game of healthcare politics. Moreover, despite our country's colossal expenditure, which now comprises over 18% of our gross domestic product, our healthcare outcomes lag far behind those of other nations. Our life expectancy trails Germany's by 4.5 years, and we grapple with one of the highest infant mortality rates among major countries worldwide. And while obtaining quality healthcare is a struggle for all of us here in the United States, the current system is especially detrimental to marginalized and minority communities. The 2023 National Healthcare Quality and Disparities Report, produced by the Agency for Healthcare Research and Quality, outlines the social detriments of health policy that play such a crucial role in a person's access and response to medical treatment. The agency attests, excuse me, that these detriments often have a stronger influence on health and use of healthcare services than the actual quality of care provided by healthcare systems. The 2023 report explores how populations vulnerable to social, economic, and environmental stressors face challenges that affect their ability to obtain healthcare services or adhere to treatment plans. As Dr. Martin Luther King Jr. once said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. His words echo through the halls of history, reminding us that access to healthcare is not just a privilege, it's a fundamental human right that should be guaranteed to all. But why does America have such a horrific track record when it comes to safeguarding the health of her people? It's because our healthcare system is fundamentally flawed. Unlike other developed nations, our country prioritizes profits for health insurance giants, pharmaceutical conglomerates, and medical equipment suppliers over providing quality, affordable care to all. Consider this: as 68,000 Americans tragically lose their lives every year due to lack of access to essential health care, yet major health insurance companies rake in over $69 billion in profits. While American families face financial ruin and bankruptcy due to exorbitant healthcare costs, the CEOs of 300 major healthcare companies pocketed a staggering $4.5 billion in total compensation last year alone. And let's not forget the pharmaceutical industry, where 10 of the top companies in the United States amassed over $112 billion in profits, where their top executives enjoyed a combined $1.5 million in compensation. All this while 1 in 4 Americans struggle to afford life-saving medications prescribed by their doctors. Yet amidst this bleak landscape, there's a glimmer of hope: Medicare. At age 65, when seniors become eligible for Medicare, the stark gap in life expectancy between Americans and their international counterparts starts to narrow. Studies have shown that Medicare has saved hundreds of thousands of lives and significantly increased the life expectancy of 65-year-old Americans over the decades. In fact, research suggests that implementing a medical for all system could save an additional 68,000 lives annually, a staggering number that underscores the incredible potential of universal health care. So, what can we do to fix this broken system and ensure that every American has access to affordable, quality health care? Well, it starts with acknowledging that healthcare is not a commodity to be bought and sold. It's a basic necessity of life. We need comprehensive reform that prioritizes preventative care, expands access to mental health services, and tackles the root causes of health disparities. A U.S. president once said, quote, "Millions of our citizens do not now have a full measure of opportunity to achieve and enjoy good health. Millions do not now have protection or security against the economic effects of sickness. The time has arrived for action to help them attain that opportunity and that protection," end quote. These words were written by Harry S. Truman in a missive directed at Congress in November of 1945. President Truman went on to propose a plan that has been described as a turbocharged version of healthcare in today's Canada, but one that he was quick to declare was not socialized medicine. As we sadly know all too well, Truman's radical scheme to actually help the people he represented never came to fruition. It's time for us to live up to our promise as a nation and ensure that every American has the opportunity to live a healthy, dignified life. It's time to recognize that health insurance is just one piece of the puzzle in this crisis. While lack of coverage and underinsurance are certainly pressing issues, they're symptomatic of a larger problem: our ineffectual approach to healthcare as a whole. We have built a system that prioritizes treating illness over promoting wellness, focusing on profits over prevention and reacting to crises instead of addressing their root causes. Think about it. Our healthcare system is like a leaky boat. We're so busy bailing out water and patching up holes that we've forgotten to ask why the boat is sinking in the first place. We need to shift our focus from treating symptoms to preventing disease, from managing chronic conditions to promoting healthy lifestyles. That means investing in public health policies that address social detriments of health, like access to nutritious food, safe housing, and quality education. As it stands now, our current system is akin to putting a band-aid on a bullet wound. Sure, it might stop the bleeding temporarily, but it won't heal the underlying injury. We need radical reforms that reimagine healthcare not as a transactional service, but as a fundamental human right. That means implementing policies that prioritize community health, expanding access to preventative care, and dismantling the barriers that prevent people from living their healthiest lives. As former Surgeon General C. Everett Koop once said, healthcare reform is a moral imperative. It's not just about fixing what's broken, it's about building a system that fosters health and well-being for all Americans, regardless of race, income, or their zip code. So, What can we do to enact real change and transform our healthcare system from one of sickness to one of health? Well, it starts with raising our voices, demanding accountability from our elected officials, and advocating for policies that prioritize the well being of our communities over the profits of corporations. As President Barack Obama once said, change will not come if we wait for some other person or some other time. We are the ones we've been waiting for. We are the change that we seek. So it's up to us to rise up to the challenge and build a healthier, more just America for generations to come. And that's the final word up front. I'm Sean Sainhart, and this is Coup Save America. Today's special guest comes to us with a unique and creative way to spread awareness about our failing healthcare system. Greg Vigdor is the author of the Tinsley Health Policy Detective Series, a two-book collection of thrilling medical espionage that teach vital lessons while also entertaining their audience. Greg has the necessary expertise to write medical fiction with authority. He brings over 4 decades of experience to the table with a distinguished career spanning various leadership roles, from CEO to policy expert, advocate, manager, and consultant. Greg is the founder and president of the Washington Health Foundation and has served as president CEO of the Arizona Hospital and Healthcare Association. We are fortunate to have Greg joining us from right here in our very own state of Washington to offer practical insights on how to fix America's broken healthcare system. And Greg will join us right after the break. We'll be right back. And we're back. And now, friends, please let us welcome Greg to the show. Hello, sir.
Hey, great to be with you. Hope you're feeling better.
Well, about that, I'm slowly recovering, but I've still got this residual brain fog. And unfortunately, long story short, I wasn't able to finish your book yet. So don't share the ending yet, because I'm still very excited to find out how it ends. And I've actually wrote down a list of questions to ask about the book. And why don't you go ahead and give us a brief introduction of the book and describe why you decided to write this book series?
So you said I spent over 4 decades working in various healthcare leadership roles, and my career passion was to reform the American healthcare system. When I left my last job as the head of the Arizona Hospital Association back in 2019, I was looking back at my career feeling really proud of a lot of the things we did and a lot of the progress we made. But the truth was, America's healthcare system is still a huge problem, as you just detailed. And I was trying to figure out what to do next, because I wasn't really ready to retire, but I sort of seemed to be a time for me to transition my life to something different. Always wanted to write a novel as a really young kid. And so I started writing, and I was going, I should write about something I know about, because it's hard enough trying to figure out how to write a book. And kind of stumbled into this notion of writing a couple of books. I started writing a medical detective story that I had started a few years back. And I was going, well, this is going pretty well. And I said, but I also want to write about health policy, because there's a lot I want to share about what worked, what didn't work, what we have to do next. And when I was writing that, I was going like, my God, I'm actually boring myself writing this book. And I had this novel idea of, like, pun intended, why don't I put the two together? How do you create a medical detective story that will actually educate people about the very real health policy issues of America, so that maybe more people like your show will get educated about the issues and be willing and able to engage in it? Because unless that happens, we're not going to see the change that we need. That's one of the core lessons I think I learned over my 4 decades of work. So the idea became to really expand on the fictional story, which is about a public health investigator who finds what seems to be a pandemic and turns out to be something far worse. But embedded in it is a tale about American health policy. Much of it is about the history of how we got to where we are, where I go back using historical fiction, but a lot of it's very accurate health policy going back to 1932, when a group called the Committee on the Cost of Medical Care issued a report, a book to Congress and others about how to fix the American healthcare system. And that began this journey of what I call unrequited love of healthcare reform. They had five key recommendations, which, if we did then, would have solved a lot of the problems you were talking about and would solve a lot of the problems today. But the opportunity then was lost. They could not find the political wherewithal to get that through. A story that repeated itself, not just through Truman, but through Roosevelt, through the Clinton
Yeah.
administration, and even, unfortunately, even with the Affordable Care Act, a successful piece of legislation that did a lot of good, but also left a lot of opportunity on the table. So that was my tale, and I also include in a series um, of creative ideas for how we can move forward on a policy level to advance, trying to not have it be the usual set of things that we talk about because those are so frozen in our politics. So I try to
Yeah.
be creative about what we might do. Although, to be honest with you, some of these things were things we propose should have happened in the Affordable Care Act. So that's really the first book, was really in bringing all, again, the context of a fictional tale. The second book is much the same, another fictional tale, but tried to incorporate what COVID meant for American healthcare. It gave me a little bit of a chance to get off my chest some of the implications of what happened around COVID itself. But there are other things happening within the American healthcare system in that time period, partly because of COVID, that I really wanted to talk about, because I think it's really raised the stakes and really created a new era of American healthcare challenges around profiteering and control, and consolidations,
Yeah.
that really means we're at a new place than even I was for most of my career. And I'm now working on more books which really take the tale forward of how we might really solve the problem we find ourselves in today.
Now, in your book, Make Most Health Corporation is the villain, uh,
Yes.
for most intents and purposes. And one of the things that you point out is what happens when power is stripped from healthcare professionals and shifted to corporate administrators. And I'm just wondering, given your experience, how accurate are the policies and procedures of Make Most to the real world?
They're, like all fiction, over the top, but also, like most fiction, there's a thread of truth in it. So probably more a matter of degree. That there's a major emphasis on dollars and making money is clear, and not just investor-owned healthcare systems, but ones that call themselves not-for-profit, even those that are historically religiously based. There's a major thread of money driving the system, and that's part of Make Most fault, and the things that they do to justify that, in the belief that somehow that's better for the people they serve. So again, over the top, but the threads of truth, I think, run through just about all my villains. That there's a degree of it that really is part of what's going on in American healthcare.
You you talk about well, I'd like you to talk about the National Health Challenge from your book. How would a program like that, could you explain that program in detail and also describe how that could help people, how we could actually fix healthcare by following a very simple, relatively simple process?
Yes. So the National Health Challenge was one of sort of 10 policies that I have enacted in a fictitious Federal Healthcare Revival Act that passes Congress. And the National Health Challenge is this idea that, well, we're going to have it like the physical fitness challenge that went back to the 1960s and John F. Kennedy, where all Americans should get fitter. But it takes it a whole other level of challenging Americans to have a friendly competition about how we can get healthy together in competing. And it's way more than physical fitness. It's about all the things that go into what makes people healthy. Some which relate to our own individual responsibility and things we can do, which is physical fitness. It is what we eat. there's a whole host of these health behaviors that are up to us to take care of, not the government or other organizations. But at the same time, there's just as many on the flip side, which is more community and socially based things that we need to do together to find solutions. The National Health Challenge that I posit in that book is this idea that you can somehow wrap that into a friendly competition that will somehow escalate and educate those issues among Americans. Here's the crazy thing about it. It's built around actually a real program that we did with the Washington Health Foundation for a number of years in Washington State. We called it the Governor's Health Bowl, and it was exactly what I'm describing. I really just took the concepts we built there to engage people, whatever their political persuasion, to come together and work with us and have a friendly challenge that we hosted on our website, and did a whole variety of sub events around to really entice people to get engaged. Um, the unit of success we had, and there were miles of health. We had enough miles of health every year to go to the moon and back multiple times because
Right.
people found it a really engaging thing to do. And they were really educated and surprised when really basic ways, like when they would get on, we'd have bicycle clubs get involved, for example, and they'd report all their miles about how they biked. And then they'd realize they could get bonus points by going on and filling out a questionnaire that we have. It's kind of a simple survey, which was educating about it's questions about health. What can you do to promote your health? And learning that health is made up of all these things. Many of the things you were talking about, from prevention to dealing with health disparities in certain populations. And yet they would get credit for actually just answering questions. So we like to say that you could be in a wheelchair and you still can participate and succeed in the Governor's Health Bowl, because there needs to be a way for everybody to access their part in this and learn more. So it's not only a sort of a crazy idea, but it's one I did, and I was just shocked by. It was so successful in our state and did so much to promote health and to create awareness and activities at the community level. We had schools, grade schools throughout the state of Washington competing against each other, so much so that when they crossed the challenge, the finish line, it was actually at the governor's mansion with the governor waiting to greet the children running up the Capitol steps. Yeah, just a way to engage people in a different way than they typically engage, which is around the political system and a lot of negativity, to say we can do this and we can do it together. And it's not an ideologic divide, it's not a partisan divide. It's things that we should cherish together about really building our country and our health.
And why do you think it is that we don't do this? I mean, I understand the politics and the corruption that's involved with corporate America, but what I don't understand is why the people are not rising up to this challenge. Why the average citizens are just not. It almost seems like we're not invested in healthcare.
The politics, unfortunately, explains a lot of it now. It always did. It worked in more subtle ways than a long time ago, but now it's really pretty up on the surface around the two parties that I frankly believe, in my experience, were more comfortable using the issue to run for office than to solve.
Yes. Yep.
So whichever one you lean toward, I would make the argument about, well, there are opportunities to enact those policies, but sort of held back on doing that because it was better to use it for fundraising and running against the opposition if it wasn't solved. And unfortunately, that's kind of how it worked. And it's only gotten worse in the crazy times that we're in now, where it's hard to even have the conversation. One of the craziest things, and looking back on this whole experience when I was writing the first book in the history, was going back to the Affordable Care Act era, and the solution that President Obama put forward was something that came from the American Enterprise Institute,
Right. A
and is a
conservative think tank.
Republican-based reform.
Yes.
And the whole premise of it was we need to build a bipartisan approach to this. One of the things we were actually recommending to his administration when they came in, the bipartisan part. When they took that, it was, oh, and we'll get some Republican votes for this. After the whole long process of getting that through, there's not one Republican vote in favor of it. And it's talked about as this somehow liberal thing that was a Republican proposal that Mitt Romney did in Massachusetts.
Yeah.
And that's a good example of kind of how the politics run amok on this. And we're still basing our solutions on that model. Is it the best model to reform American healthcare, in my opinion? No. There's a political reason to do it that made sense, but the political reason proved to be an illusion. And instead, we're kind of still basing our solutions on what I think is an imperfect model for moving forward. And that's one of the things we have to figure out how to get away from, even as we're trying to figure out if it's what is that proposal? Is it conservative? Is it liberal? I don't even know anymore.
Yeah. No, throughout your 40 years of experience, which is a long time in the healthcare field, um, what are the most significant changes that you've noticed in healthcare, in our healthcare system?
So the biggest ones are what I write about in my second book, which is the consolidation and the emphasis on control, and with money is part of that. So the profiteering is part of it, but I think it's much more about organizations, whatever they are, whether they started as hospitals or health systems or pharmaceutical companies or drugstores or um, entities that had nothing at all to do with healthcare, starting to build corporate enterprises around the full healthcare continuum into their packages and having get bigger and bigger and bigger. One of the core threads of healthcare throughout my career and its core strength was that if you really wanted to talk about healthcare delivery, insurance and financing may be a different matter, but actual delivery of healthcare to people, it was a local community matter. That's where it worked best. That's where it's naturally works best. Always has, I think always will. But as we start to do these consolidations and hospitals by other hospitals and health systems by other health systems, and all these organizations get bigger and bigger, we are losing that community thread to corporate enterprises, sort of much like the airlines went through their own sort of iteration like this many years ago. And I think as we saw with the airlines, it just got it further and further from the people in terms of practical
Yeah.
solutions and consumer accessibility and happiness with it. And we are really going pretty far down that road now. COVID, among other things, it just created a cloak where it was far easier for that to happen in sort of the darkness of the pandemic. And so, but again, I go back to this core principle: if it's local, it's about us personally. You can't get healthcare too far away from the essentialness that is us as people and communities, and that's where we are right now, getting further and further away every month as more of these transactions happen.
Yeah, no, I'm with you 100% on that. I mean, Amazon
Yes,
is now getting involved in healthcare,
yes,
which is just an absolute disaster. Being here, a fellow Washingtonian, I'm sure you're familiar with the Everett Clinic.
yes. Worked with them many
Um,
years, way back when.
did you really? That's awesome. That's where my doctor is, the Everett Clinic, and I've been with her for over a decade. And great doctor, and the Everett Clinic, I think, had a model of healthcare that was very patient-centered, and unfortunately, they got purchased by, a larger conglomerate, and, um, from some of the doctors that I talked to at the Everett Clinic who have kind of experienced this transition, they feel a loss of control, and things have really started to turn away from the original mission of the Everett Clinic, which I think is incredibly sad. And that kind of goes to what you're speaking to, this consolidation of all of these community clinics that started with a very close community ties now being taken away and losing power.
Yes, and a very common story across America now, but also a common story in the physician community is throughout most of my career, most physicians were independent
Right.
practitioners that celebrated their independence, sometimes too much so. But now it's the most of the time they're employees of
Yeah.
one organization or another. One of the other things about the Everett Clinic model, if you go back to that 1932 report I talked about, one of the five core recommendations was that really how healthcare should be organized is around a group practice model, which is teams of physicians coming together around the
Yes.
patient. That's why it is patient centered, because the healthcare system, by its nature, and the scientific discoveries that really were what created the boom, our ability to actually intervene and help people because of anesthesia and the germ theory of disease, things like that, it organized scientifically, which means you're into different sort of specialization, and the medical profession organized around that. When you start talking about people, they are holistically challenged, And the opportunity to have physicians from many different perspectives be able to come together around the patient, that's at the heart of the successes of things like the Everett Clinic, the
Yes.
Mayo, these organizations, that's their premise is we're here to try to figure out this complicated thing that is a human being and how to treat them in their most vulnerable times. And that's also what we're losing as we become more and more of these enterprises that are driven more by the money and the corporate strategies than necessarily the clinical people who are trying to come together and lead the innovations that will make health improve.
I often feel, and maybe I'm wrong, maybe I'm right, but it often feels like the American healthcare system is on the verge of collapse and is almost beyond saving. Um, and I say that because we've got a number of physicians across the country that are basically aging out. They're retiring from the profession. We don't have enough new medical students to replace them. So we're going to be in a huge deficit of providers shortly. And a lot of doctors, a lot of students rather, are looking at the medical profession and saying, I don't want to get involved in that. The system doesn't work. It takes power away from the doctors. It's totally profit centered. Am I wrong in assuming that this whole system is just on the verge of collapse?
Well, I've always been an optimist, so I don't really allow myself to think that way very often, even though I'm getting more concerned. I do think it's gotten harder, and maybe more pessimistic than I have been throughout most of my career. I do think there's ways through it because you can't get away of just how important healthcare is to everybody.
Right.
Everybody has a healthcare story, and many of them are unhappy stories about their experience. And again, with the system filled with talented, bright, committed people trying to do the right thing, they're sort of stuck in a system that doesn't work. I just can't believe that that can maintain itself if we start to really have it sort of get to this next scale of dysfunction. So there's ways to, even the problem you're talking about, one of my solutions in my Healthcare Revival Act, one of my 10 points is that we just need to have a lot more support, government support for training physicians and other healthcare practitioners. One of the things, again, in that 1932 report was essentially that we need to do that. We need to educate them the right way to make sure they can think about things so they can go forth and practice with their knowledge. So again, there's ways around some of the sub problems, but we still have this problem of where we are right now and the understanding of it that I think we have to get through before we can actually move to seeing solutions.
What are the 10 points that you mentioned?
So said there's 10 different policies I try to come up with as a sampling of creative ways to think about it. My first one was always my favorite. This is actually what we proposed during the Affordable Care Act debate as the Washington Health Foundation's is why doesn't the United States have a set of clearly articulated national health goals with metrics attached to them and accountabilities that would flow to that? And if you did have a goal, let's say you had 3 goals, 10 goals, one of those goals would be around cost, and is the most costly system ever created by man anywhere about anything.
Yeah.
And what if it said that costs weren't going to go up more than 3% a year, just to pick a number? And if they did, that somehow you'd actually make sure that they didn't. Maybe it's clawbacks from provider payments and insurer payments, whatever. Well, we would. My point is, we would start to achieve those national health goals, whether they're about cost, whether they're about more preventive services, whatever they might be. And with the healthcare system, one of the things we know in creating change is with healthcare providers that if you start to attach metrics around patient clinical experiences and hold them accountable to it, things will change and they will change rapidly and to the better. And so, again, the notion of health goals becomes one that can not only flow through our lack of willingness to take on the tough issues you're talking about. Politicians don't like accountability. That's why they didn't like our idea. But it not only deals with that level of it, deals with a system which responds to metrics and clear metrics and accountabilities in getting there. And we would see change at all levels of what needs to happen to make American healthcare better. So that's one, that's the first example I'd throw out there. I can give you more if you'd like them.
Yeah, please.
Well, the way back then, Medicare for all, you mentioned it, and it depends what we mean by that term now. But back in during that debate, one of the things we were saying is if you just want to practically move forward with trying to get more people workable coverage, is why don't you just make Medicare It's the actuarial equivalent of what it would cost available to anybody that wanted to buy into it. And you would immediately have a public option, which was the debate back during the Affordable Care Act days and still is part of the debate. But it would just say, here's one way for everybody to get in. And if private health insurers can do better, great. If they can't, and this is what people buy, well, we have an answer.
Right.
Right. So the public option is actually one of my 10 points is we need to create one that's not somehow, I believe, driving people where they have to use the government option. As much as I'm not a fan of the insurance industry, I don't think we want to create disincentives like that. I think we want to make it a fair competition. But by God, we need something that everybody can get in, because we cannot solve our problem as a system unless we continue to reduce the number of uninsured people. Whatever you
Absolutely.
think
Yeah.
about the uninsured, as a system design matter, you cannot fix a system that has so many uninsured people that can get their care elsewhere in the system through basically through hospital emergency rooms.
Yep.
That's a dysfunction that is carried through the entire healthcare system since the beginning of the new age of healthcare. When we discovered that we could do good for people, we have been trying to deal with the consequences of those people coming in and getting that care through the ER and other devices for decades. It's the cost shift in healthcare. People know what that represents, is all based upon so many people getting care for nothing because they can't pay for it, though they're sick and need it, and it being built into the price elsewhere. They're just distortions that make a system solution virtually impossible. And so again, we need to get that the number of uninsured down. The Affordable Care Act, its success was doing that more than anything since Medicare in this country. But we need to do more, and the underinsurance problem is actually becoming a big problem now, as more and more of the types of policies that are moving forward are shifting the costs over to the individual,
Yes.
and sort of creates another system distortion. So that's another big field that we have to get a handle on. Again, my solution, public option, starts to immediately move the whole problem into a different league.
Now, a lot of people that I talk to do not understand the public option. Can you kind of explain what that public option is and how that would work?
Well, the derivation of that sort of phrasing goes back to the Affordable Care Act debate, where, again, using this conservative model, the idea was, instead of having a government health plan that would provide access for everybody, you would say private insurers can basically put forth their best ideas about how to structure a plan within a certain set of rules that were started prescribed in the Affordable Care Act and then in regulations. And the idea was, well, they can just all compete and we'll put it on this thing called an exchange. I mean, this is all so complicated. That's why it got difficult. But the idea was, well, what if they don't? How do we make sure we get something that everybody can participate in? And the idea was, well, you just create a public option that is basically a government based and developed alternative to the private insurance plans that will make sure that there's something out there that collectively all say that's maybe a baseline, a simple way for people to go, an option for people to go to, but they're not required to. They can get the private offerings if they want, and that's what they prefer. And it was just really opening it up to make sure there's some balance in there, so it's just not the marketplace, the private marketplace, saying here's what you can have, and we've all come together and decided it's only these. And that was the idea. Well, if you just base it on Medicare, which people tend to really love, I'm on Medicare now, it's the best health coverage I've had,
Yeah, me
then
too.
you're kind of there.
Yeah, no, I'm disabled. I've got major health problems, and so I'm on Medicare as well, and I love it. I've never had any major issues with it. I've never had delayed care. I mean, all of these nightmare scenarios that you hear about with the so-called socialized medicine have not come to fruition for me. Now, I do recognize there are problems with Medicare.
Yes.
Um, but these are problems that I think that we could certainly solve. And as I said
Yes.
in the monologue, Medicare has increased the life expectancy of seniors just by having Medicare. So to go back to the public option for just a moment. So the public option would essentially give people the option to enroll in Medicare as opposed to, or they would have the option of staying with the private health insurance industry. Is that kind of a good summation of the public option?
Yes. Yes. Using Medicare for all as a public option model, as opposed to something that's really just a government based program in some other clothing. But that's the heart of the public option. You just create and using that as the base rather than creating an entirely new program.
And how difficult would it be if to implement a public option? I mean, we hear this rhetoric about, well, we could never have Medicare for all because the system is too complex and it's too it would be too costly and all of these other nightmare scenarios that we hear with rhetoric. How difficult would it actually be to transform the system in that way?
I don't think that complicated, and certainly relative to the complexity of things like the exchange and the choices that people have to try to wade through right now. I've had this conversation with different people who have told me, "Oh, it is too complicated to do," and I'm going, "It doesn't." I've met with actuaries; it doesn't seem that complicated. I mean, they put me to sleep with their calculations, but the notion of somehow just pricing out what the actuarial equivalent of that coverage is for people who aren't fitting into the categories of Medicare eligibility doesn't seem like rocket science to me. Seems like a lot of math. But it's the end of it's just going to be some simple numbers that people go, is how much a month is it? So
Right.
I just don't buy that. I've heard that argument time and time again. It was just impossible to do. I don't buy it.
Politically, however, we're sort of at a stalemate. As
Right.
you mentioned, I blame both parties for this. They don't seem to be serious about tackling the issues. Well, they don't seem to be serious about tackling the systemic issues, eh, period, in this country.
True. I'd agree.
Uh, and how do we? And I know this is where it gets complicated because we have this corruption problem where corporate America essentially owns our politicians. How do we get any meaningful reform done? I mean, how do we kind of go back to that community-centered approach to healthcare in this country with a political structure that is just impermeable? It seems.
Yes. I think it has to go back to the people, and certainly maybe partly politically and voting and all of that. But I actually think it's much more basic about trying to find the core of Americans who believe they want solutions to these problems and be willing to get outside of their tribal identities to their parties and to certain politicians and to say that we want the collective response to practical solutions. The governor's health poll that I was talking about was actually just a program of the Washington Health Foundation testing that notion in Washington State. And what we did was go out and talk to people as in their communities and with polling, and a number of different methods just to practically give them choices about how we might move forward. But we didn't let them go to the usual places in how we structured it. It was sort of seeing if there was actually some type of consensus out there for what people thought about healthcare problems. And we found what I would call violent agreement that there are these problems, that we should come together, we should have practical solutions, they shouldn't be ideologically and partisan driven, and there are certain values that we have and hold together as Washingtonians, whether we're liberal, conservative, Republican, Democrat, and that if you can sort of identify those things, you can start to compromise about the specific policies that get implemented. We found actually a base of support for people willing to come together and move forward on it. The political system fought us greatly when we rolled that out and said, how can we move on this social capital that we're building and have in this state? And the usual parties, again, on both sides, start to capture and say, oh, but we're not going to do that. We're going to do this with it. We have to figure out how to make innovations like that, I think, more thematic throughout our states and our communities and our national politics. Again, back to my books, that's my dream, is that we're able to get a more elevated understanding of the issues outside of the typical way they are presented, where people will start to go, no, I want a solution. I demand a solution, and I'm willing to sort of, again, get outside of the typical way of responding to political opportunities so we can actually see these get rooted in real policy that makes a difference in my life, not on some clip for a political ad.
Right. What is the third policy initiative of the 10?
Let's see. So one of my policies was to try to do some type of regional health budgets in distributing the money across America. So trying to, again, one of the solutions talked about years ago is more global budgeting, taking the healthcare dollar and investing it better. And because so much of the complicated healthcare system gets to the state level, especially because of the Medicaid program, my idea with the regional budget was mostly try to break the the calcification at the state level too, and sort of force states and regional groupings to have to come together and figure out how to allocate money around health investments for their citizenry outside of the boxes they're stuck in right now at the state level. It was even related to the national health competition. The idea was, well, if you have a state by state competition or region by region, maybe the winners get a little bit more money to distribute. So again, creative ideas, thinking outside of the box, ways that will break the usual way we've approached these issues historically.
I'm loving these ideas. And I'm loving the way that they're implemented in the book. It's disheartening that it's a fictional story in that sense. I want to get back to your 10-point policies, but I first want to ask you, in the book, you've got this Committee for the Future of America. Uh, and this is a secretive sort of organization. And I'm wondering how likely it is that something like that does or could exist in the real world.
Yes, so the Committee on the Future of America comes out in my second book, and is this organization that sort of uses things like a pandemic to get at the heart of what they're after, which is thinking about America a very different way, as a much more elite driven um, society. I wouldn't even necessarily say fascist or some of the typical models, but much more about there are certain select people, more like the Politburo of the Soviet days, who are kind of going to govern America, don't really care so much about democracy or civic engagement. They just want their way to go through. And so I hypothesize that this group is out there operating, and not only is operating, but is looking at American healthcare and its dysfunction as a great wedge issue that will help them achieve their dream of basically beating down belief in America's democratic traditions and practices. Um, uh, Again, fiction over the top, but definitely for me built on the thread of something I think I found, which is that there are definitely these groups out there trying to figure some of these things out right now. Whether they're on healthcare, I don't know, but certainly I found clear signs and discussions of groups that seem to be oriented in that direction.
How do we combat this?
Again, it's about the people. It's you get what you deserve on some of this, and so at some point we just have to start taking control of what matters to us collectively in in a true democratic sense, not be driven by sort of minority views that are so select that they don't really carry the weight of what we as collectively as a people really do fundamentally believe. I mean, I grew up and worked in a lot in these majority rule dynamics where it's, like 50 plus one. Well, we're looking at consensus solutions of 60 and 70% of people who think something should happen. Well, it should happen in America. That's pretty wide margin in a society like ours. But there are issue after issue where it doesn't now.
Yeah. Well, my God, just about any issue at this point. I mean,
An awful lot of them.
yeah, we can't obviously have a conversation about anything these days without talking about Donald Trump and what America would look like under another term of President Trump. What are your feelings on that? You kind of allude to some of this in your book, and I'm just wondering if you could kind of explain more in a broader sense.
Well, it's largely informed by the work that I did in Arizona. I was there at the head of the hospital association when he was elected. Like just about everybody, I was really surprised by that. And but I knew that one of his campaign pledges was to repeal the Affordable Care Act, and that if you looked at the politics of the moment of that, what was really clear was that the path to having that happen in the United States Congress flowed through only about 20 uh, congressmen and senators, of which several were in Arizona. And so it suddenly became my duty to try to figure out how to get involved in this and make sure if that's what's going to happen, we do it in a way that's not going to just cave in the American healthcare system and the Arizona healthcare system, which as is a huge part of Arizona's economic recovery was its healthcare system. Um, so so my experience, what I mean by the experience was watching it and just realizing how little it was driven by any intelligible policy. I mean, there finally was some legislation that came out that said this is what we want to do. Never, I don't think it really even got out there publicly, but I certainly got to see it and try to make sense of it. It was really just about cutting budgets in Medicaid, and in a way that was just going to crush Arizona. So that became some of the basis of me talking to people like Senator John McCain about the issue and having people across the state talk to him about it, what it would do in their community. So I don't have a lot of confidence that if we have another Trump uh, um, presidency, that the policies are necessarily going to be anything intelligible or like anything we've ever seen before. And that unpredictability and the danger that is going to be captured by some groups that really don't care so much about health policy as they do about other issues
Right.
and the means to the end, that makes me very nervous that we could be in for a really rough go. Again, it's possible it comes in and does the right things start to happen in his second term. I would believe anything at this point, but my gut tells me to be very fearful.
Yeah, and it's very disheartening because you look at President Biden, and I just don't think that he's confronting the challenges that we face in this country. And I think that's part of the reason why Trump is surging in the polls, is that there's still this discontent that people have, and it goes back to these systemic issues, which we're not addressing across any metric.
Right. Yep.
Uh, So this is exactly the system that generates authoritarian figures like Donald Trump in the first place. We've seen this throughout the world,
Yes.
and that scares me more than anything. And I just want to just yell at the Democrats, like, why aren't you doing more? Why are you allowing the corruption to fuel your decisions in so many regards? And I think I'm scared too, but I think it's very possible that we will see another term of Donald Trump. And I don't know if you saw the headline in CNN today, but Donald Trump has previously attacked his opponents for any mention of cutting Social Security and Medicare. And either yesterday or today, he's come out and he said, "No, I'd be in favor of cutting Social Security and
Hmm.
Medicare." Um, and that would be, what would the consequence of that be? I mean, that would be catastrophic for so many people.
Yes. This is no other way to put it. I mean, it's the baseline for so many millions of people in their healthcare. I just don't believe it would be possible. I do have limits to what I believe. I just don't see that being possible politically. Um, I mean, there's a such thing as voting against your interests, but that's a road, big road to cross.
Well, do you think that the Republican Party, I mean, the Republican Party has evolved into something that is almost unimaginable in a very short period of time. If you were to get a Republican majority, do you think it would be politically possible, or do you think that would be a red line even for Republicans?
Only if that majority was built on the extremists that we see getting elected regularly now. I could see down the road a little bit, not this election cycle, but two or three down, if we continue to sort of capture the processes of government where more where the slivers can really drive the agenda. We don't really have contested elections in most cases in the general election. It's about primaries. And so it's this race on both sides of the polls. And so we're getting on the Republican side is these really extreme
Yeah.
candidates, and all they have to do is win the primary, by having the really extreme people in their districts turn out for that. There's not close to a majority of those people in their districts, but it doesn't matter. If you see more and more of that happening, again, I can't imagine it just in just a few elections. I think that's got to take place over a decade or more, where suddenly we migrate and we have a Congress that's completely out of touch with America, just adopting these policies, which really most people don't like. I don't see that sustaining either. That's where I start to get really kind of crazy. I just don't see people accepting that.
What do you think would happen? I mean, I don't think people will accept it either, but once it happens, how do you kind of reverse course?
Yeah, hard. I think we start to lose faith. I think we all start to behave in bad ways, and we start to see sort of the breakdown not necessarily in civil war or anything like that, but that's possible. I think we start to see even greater distrust of government and an unwillingness to do the things that we right now mostly accept as our obligations of being a citizen. We see that, I think, more on the other side of this conversation now. I think that becomes more the norm, and we see where that goes. Not something I'd look forward to or enjoy, but you could certainly make that argument and say, here's how it's going to play out, and it might have to be part of a book I write. In fact,
Yeah, well, you're going to continue the series, I imagine.
yes.
Perfect. Um, I want to go back to the 10-point policies because you articulate them so well in your book, and I wanted to go over some additional policies that you had mentioned.
Okay.
What else do you have to throw at us?
Let's see. What the some of the really crazy ones?
Yes.
Here's one. That it's my next book is actually about death in America and how we process that, but also how we decide who gets life-saving treatments, of which there's profound discoveries happening all the time, with devices and drugs and other things that can save people's
Absolutely.
lives. And some of these are really expensive. And the question is, who gets them? And right now we know that if you're really wealthy, you can get them because we're such a capitalist-based country. My idea is to say that, well, that's not fair. If you want a system that's stable, you need some degree of fairness in it. And just doing it on the basis of money doesn't cut it. But what does cut it in America? Well, we accept lottos and lotteries like nobody's business. So my idea is that everybody would be eligible to enter a national healthcare lottery to get access to these intervening treatments at no cost. It's sort of like winning the lotto. I don't know what the odds are. I don't know if it's like 1 in a billion, like it is on that. Something probably more, maybe it's a 50-50. I don't know what it is, but it's the notion of there's a national healthcare lottery to get access to these costly life-saving treatments so that everybody has a fair shot at it if they're not multi-billionaire.
Yeah, that again, the ability to buy care is problematic because it does benefit the elite.
Yes.
And going back to the COVID murders, and if we can put the cover of the book up again, that would be great. How are COVID deaths identified and reported by hospitals? And can you explain the parallel that you mentioned in the book between COVID and diabetes?
So I can't say I ever completely unwrapped how it is it's accounted for. It's just hard to account for deaths was my point in the COVID murders. The background to it, so the listeners understand, was my hero Irv Tinsley gets called to Nashville to solve a problem with so a death at a hospital, and turns out there's a series of deaths, and it happens during the COVID period. And so one of the easy explanations that people would go is, well, it's COVID did it. And so, we don't have to really research any further. They got COVID and died. And the surface, you could make that argument. Well, it's hard to know if that's, even if it's what they say it is with the reports, you got to dig deeper. And Irv does. And in terms of my case, it's really not COVID, it's something else. But the argument I was trying to make was the people who say nobody died from COVID, I don't go there, but that a million people died in COVID, I don't know if that's accurate, because a million people died, I'm sure. I don't question that. It's just of what? And
Right.
was COVID a contributing factor? People, and so diabetes is a classic example that goes back into time where people were dying from things that were on the death certificate as stroke, heart disease, amputations gone wrong, just a whole series of things. But actually, they were dying from diabetes because that's what they had, and that's what was causing all these problems. But you didn't see diabetes as the cause of death on the death report. So my intent was more to expose that, the people who question the number of deaths, they have a point around that for sure. And that but we have this problem not just in COVID, we have it with other things about what truly is the root cause of our health problems. My point was actually much more in your introduction to the show, we were talking, this is what we need to understand about how to intervene if we really want to get ahead as a matter of policy. We have to get out of the sick care system and trying to deal with what's on the death certificate as the ultimate reason for why you die, to what it is that actually might make a difference if we could treat it when it's still manageable. And diabetes is the poster child for that, where if you can get people, stop people from getting it in the first place, you'll
Right.
save their health and billions of dollars. Right. But the consequence of not catching it is amputations and heart disease and stroke and Alzheimer's and all these horrible things that none of us want to see on our worst enemies. So that's what a matter of policy. It is one of my other recommendations. How do we invest more in prevention? A lot more in prevention. But it gets to really understanding the pathologies at play and how we disassociate them and attack them. And our historic ways of doing it are kind of screwy, is my point.
Yeah. No, screwy is putting it mildly, I think, actually. What could we do more for preventative, or what do we need to do in terms of preventative care? I mean, I know that people are not going to understand necessarily the links here, but I mean, public education, improving public education is a social detriment to health to not do that. Um,
Yes.
Access to nutrition and food. I mean, we've got food deserts in this country. Um, what are the systemic issues that we have to confront in terms of getting to a point where we're focusing on preventative health?
Yeah. So two general areas, both of which are complicated, I'll try to lay out. One is you're starting to get into what I call the social determinants of health. And sort of there, it's a matter of education, of just understanding the big picture, which is that if you posited trying to invest money into promoting people's health, understanding that at best 8 to 10% of it should go into actual medical care. The other 90% should be going into other things, from nutrition to transportation to housing, to income gaps, to individual behaviors around physical activity and nutrition. Yeah, not all social things, but individual things that people
Right.
should do. But you wouldn't put all your money in medical care. And we put, in our country, we put most of it there. And so that becomes a problem. But the notion of preventive services, the other way you can attack it to make it a little more marginally acceptable in terms of the politics of how people think about that whole bailiwick of issues, is to understand that if you just focus in on what I would call clinical preventive health services, things provided by the medical care system that will actually help promote prevention, there's a huge way we can go in making sure those things are available and accessed by people. Available is structural policies, but the accessing it is actually, in many cases, largely upon people to get educated and understand it. They should be asking about it. It's a
Absolutely.
crazy thing. There's this group called the Clinical Preventive Health Services group that for decades has been out there publishing consensus agreement on what those set of clinical preventive services should be. They're in court right now, and only in America, being challenged on their ability to do it for things in the last decade or so. A sort of crazy challenge that's sort of getting at the Affordable Care Act in a different way. But again, and it's also been complicated because one of the set of services that we used to talk about as one of the easy examples to get people to understand was vaccinations.
Right.
Now you say the word, and I'll probably get phone calls from people wondering why I've crossed over into the great divide of vaccinations, that not understanding they're our enemy. So again, some of the things on that list sort of now evoke a political reaction. But again, if you look at the body of work, there's a whole set of things: breast cancer screenings, just again, many things we could do. And if we did, our health would actually be substantially better. When we tried to do metrics around, as our foundation, around how we could promote what we called our healthiest state in the nation campaign, we took clinical preventive health services as one of the core metrics we would use and compared ourselves to other state in terms of how many people in our state were actually receiving those services. And I think it's actually one of the better methodologies out there, again, and going back to this notion of health goals to use, that would drive us toward health. And again, within the medical care box, not this maybe sometimes too hard to understand box of social um, issues, but the medical care box. And if you advance that, we would actually see a major acceleration in prevention and all its consequences, which are mostly good. People healthier, a lot less money for sick care, a lot of more opportunity to invest in other things, including the social determinants of health. So, long-winded answer. I
Yeah.
hope it made sense.
No, absolutely. As a founder of the Washington Health Foundation, and as you mentioned, the former president and CEO of the Arizona Hospital and Healthcare Association, what lessons have you learned about driving meaningful change in healthcare organizations and systems?
One of the biggest ones, I talked a bit about it earlier, that you have to find change where it can happen. Um, Otherwise, it's just tilting at windmills. So again, the example of for the medical care system and clinicians, if you find metrics related to clinical care and you could give that to them in ways that compare them to others, they will respond, and they will respond quickly and clearly and well. So that's one of the things I learned is you got that, run with it, build it and run with it. Similar to some of the notions about trying to get the public to sort of grab on.
Yeah.
That's where you got to get the root of change of there. And if you can't do that, then again, you're probably tilting at windmills. I learned that there's not too much sense dealing with the political system on this and this current construct because it's just so partisan and divided. It's almost a waste of time to even have those conversations. So as I got older in my career, I had less and less conversation with politicians and state legislators, and it just was useless because I knew what was going to happen in 99 times out of 100 if I that was my approach to trying to create change. But building it more in people, whether it's politics or what they can do in their own behavior, you've got something you can work with. People want to be healthy. They don't like being sick. They don't want to spend all their money on healthcare. They want a better consumer
Yeah.
experience. Again, people want that. There's ways to give it to them. Use that as the basis for change.
How difficult is that, though, to even accomplish without focusing on a political problem? Because, I mean, unfortunately, the political impediments to healthcare are so insurmountable right now that it seems like even minute change is difficult. Has that been your experience, or do you think that minute change is still possible even today?
Minute change is still possible. We've always had an incrementalist system. It's just that minute change isn't really going to change much. Um, and by minute change, it is much more in those boxes of what's politically acceptable. I think more smaller change at the people level is different. It's one person at a time. It's one community at a time. It's one group at a time. That minute change is worth it because it builds up and it leads to other people saying, I want the same thing. And there's a difference. And so that's my preference, is to try to figure out a way to accept and even acknowledge and even talk about the political dysfunction, but always do it. That there's still things you can do. You don't have to be a full victim in this. Yes, you're frustrated. Yes, a lot of it's being driven by forces beyond your control, but there are things you can control. You can take control of your own health. We've got tools on our website that help people do that. Don't just be a victim of the political system or the healthcare system. Um,
Where
so,
can people find those tips at, by the way? You just mentioned your website. I'd like to go ahead and provide that for our listeners.
yeah, the Washington Health Foundation, and should you Google that and it'll get close, it's washhealthfoundation.org. And there's a section on our website that talks about what we call health home tools. And we haven't done anything with these in quite a while, but we developed them over a decade ago. And there's I think there's 31 different tools that we have there that people can just download and fill out and use to take control of their healthcare. What do I mean by that? Well, one of my favorite ones is we have a form that relates to for your physician office visit. And so many of us were having to deal with new physicians, and we're going in and they have like 8 minutes to talk to you.
Yeah.
And maybe one of the examples I use is you're going in there for some communicable disease and you're kind of embarrassed by it. And so they come in and what's wrong? And you kind of hem and haw and you talk about two other things. You never get to your communicable disease, right? Because they're fit and they're just out the door. Well, mine is, it's a simple form. You say, why are you coming to this office visit? 1, 2, 3, just write it down on a piece of paper, give it to them when you walk in the door. You've changed the nature of your relationship. You're no longer dealing with the medical systems. Here's how we do your visit. You're saying, I came in here to deal with my communicable disease. It's number one on my list. Now you now know that, even if I'm embarrassed to say it. So really practical tool, changes the dynamics. It works. I've had people tell me that they've used it and said, thank you for that. It was pretty simple. We just sat around. I mean, it's really smart people come in. What else could we do that would create change on that basis? Just simple things to help people understand how to have your own medical records in one place, so that every time on a form you go in, you don't have to try to somehow fill out yet another paper form on somebody else's and sort of get everything wrong, because who remembers the last time
Right.
they had their tetanus shot, right? So
Right.
again, 31 tools, they were all just intended to sort of start to create a revolution of let's think this way about the system and have people bubble up the response to the system rather than the other way.
So speaking of the Washington Health Foundation, what initiatives are you prioritizing to address the most pressing issues in healthcare today as a foundation?
Well, the sad answer is not much. We ran out of money like 10 years ago. So
Mm,
it essentially has been in mothballs. We generated a bunch of money, but our commitment was to spend it to try to create change. We thought we'd have 3 years to do it. We ended up having 20. But at the end of the 20, we just sort of could not get enough money to keep doing our initiatives. So we kind of scaled it all back and have held it more as a legacy organization and website where we could share what we learned. The major reason it's still alive is that instead of, if let's say my book sales ever really take off and produce meaningful streams of revenue, all the revenue from my books goes to the Washington Health Foundation. And so our dream is that somehow we'll sell enough books and can reactivate and start doing the creative things we used to do. And that's why it's still alive. But it's really more of a holding pattern than anything, and a place where we can still use some of what we created, the lessons that we learned, a platform for me to blog once in a while, things like that. It would be great if somehow we could revive it. It was a fabulous organization, did wonderful things, but it's been a good 10 years now since we really did much of anything at the programmatic level.
yeah, that's really sad. Um, and unfortunate, and again, typical of how things operate in this country right now,
Yes.
where innovation is stunted. Um, and again, you mentioned some excellent ideas and tools that are practical. Give me another item off the list of things that patients can do to take control. I really love the idea about writing down what your main reasons for the visit are and handing it to the doctor. What are some other ideas that your website has?
It's been a while since I've been into that section. So some of it's been about nutrition education, just helping people to understand what is healthy. And again, not necessarily the complicated food pyramid things that are
Right.
the
That's very
question.
political in itself.
Exactly, exactly. So I'm trying to remember exactly how we
Mm.
approached that tool, but it was trying to use different communication metaphors to try to get through the simplicity of thinking about what you eat and being more conscious of it. Um, I'm blanking on some better examples. I know I haven't. But I should have thought about that before I got on the call.
That's okay. Well, here, let me ask you this. Again, there's so many questions that I want to ask you. I had to write them all down. And I know that we won't get to all of them. Um, but given your experience as a consultant in healthcare leadership roles, what common challenges do healthcare organizations face implementing reforms, and how can they overcome those challenges?
Oh, it's the complexity and the cost and the risk of change. I mean, change is hard on everybody, every person, every
Yeah.
organization, and the complexity of the healthcare system and the risks inherent in leaders who step out ahead of where things are to try to make a difference. It can be dangerous. I can go back to the 1990s when it was when the Clinton reform policies failed in Washington state. We actually passed comprehensive health reform legislation right around the same time using a similar but much simpler and practical model. And the thing was, there were a number of health system and hospital executives who got on board with that. I was working for the hospital association at the time. My instructions were to get the thing passed, and it wasn't necessarily for their self-interest. It was because they believed it was the right thing to do. That and those who actually implemented the reforms really quickly to get ahead of the game, the whole thing crashed politically in Washington state, and it was all repealed except for a couple
Mm.
small pieces 3 years later. Those that had stepped out ahead, many cases lost their jobs because they were now operating on exactly the wrong assumptions about where the system was headed. And financially, and in terms of leadership and confidence, things went downhill for them. They did the right thing, they were leaders, but it was still a dangerous endeavor. And it's still the same thing. I mean, it's not easy stepping out of where the norms are in any organization or America.
Yeah, but it seems like the people are already there, right? I mean, the people want reform. Is it just a matter of we're not applying enough political pressure, do you think?
I don't think they have a chance to get the reform they need or want. Their choices are driven by the system, not by the reform that is in their head. I mean, you talk to people again. This is what we did back in our project with the Washington Health Foundation. Back that was also around the turn of the century. It was just practically what do people want, and sort of they want better consumer experiences. They kind of want to know what things cost before they pay for it all and then get a bill. These are the things people want. That's not what they're being offered as far as solutions go.
Yeah.
In almost all cases, it's other stuff that's like, I'm not really meaning to choose that. I want these answers for me and my family and the people I care about or my community.
What are some of the key lessons, do you think, that we can learn from past efforts to reform healthcare in this country?
Yeah, I think I've talked a lot about them. It is sort of how do we get through the politics is a core one. Going back to that 1932 committee, that's what did it in. It was the opposition of the organized medicine didn't want to see it happen. But other times there's been other factions in our society that have fought it. So I think it's understanding the scale of it. The amount, yeah, it's just so many barriers now. Since I actually started my career, the money in politics thing has gotten so much
Yes.
bigger than when I started. It was always a problem, and now it's like add like 5 zeros.
Yeah.
um, so that's a big one. But again, I'd also say it's the understanding that most people tend to agree on the practical side of the need to do this and the need to do it outside of partisan ideologic solutions and are willing to compromise. It's not something that people get to see very often in the dialogue about it. And if you could somehow reach into that and suck out, but is I still think an American residue of goodwill and belief in each other, we got a chance. If we don't, I'm not sure we have a chance.
Well, speaking to that, what are the potential consequences of not enacting significant healthcare reform in the United States and doing it soon? I mean, what could we be? Like I said, I mentioned earlier. I mean, it feels to me like the whole system is on the verge of collapse. Um, what are some of the other consequences that I mean, we're already facing some of them now, the unaffordable and so forth. But going down the road, there's going to be another pandemic of some sort. I mean, we know that that's coming. What are the consequences of not enacting significant healthcare reform and doing it soon?
Yeah. So if you start to pull apart the healthcare system as a system designer would and say what are its faults, most people would get to, even though all these are huge problems, the most stark problem is the cost of American healthcare, and it dwarfs the costs in any other industrialized nation in the world
Yes.
by a long shot. Um, it's when I started my career, it was 8% of the gross national product was what it was called then. It's not called the gross domestic product. And the dialogue back then, this was in the late 70s, was if it ever got to 10%, we would be in crisis. Well, we're just about to hit 20% if we haven't already and shooting up. And every time that shoots up, you squeeze out the ability to pay for other things. Through most of my career at the state level, the fight that I was in, um, when I was defending healthcare interests, but also trying to do reform, was whatever was going wrong with the healthcare system in terms of that cost curve was impacting directly uh, uh, education, especially K through 12 education, and the ability to invest in teachers and teaching our kids. That's just one example of many. But as we get, now that we're at 20%, I think we're there probably, we are already in this place where things are being squeezed out of our ability to invest. And if it keeps going the way it's going, that will get worse. And we'll get to the point where you start to really can start to hypothesize the unraveling of society, the inability to invest, or the necessity of using debt financing that will plague our children and their children in ways that we can't even do the math on at this point.
Well, haven't
So
we already reached that point as far as our deficit is concerned? I mean, we've incurred this huge debt that we're passing on to our children already.
yeah, I think so. I mean, we had this even 10 years ago and it got better with some solutions. So I kind of like to believe that maybe we still have a chance to put that genie back in the bottle. But you may be correct. I'm not close enough to it or don't have the skills to really understand. But again, we were in a position back in the Clinton era. That was one of the driving forces to their proposal on healthcare reform. Was it wasn't we really wanted to tackle this? We have to, because the federal budget is just a mess, and this is the place where all the money is getting spent and growing. Um, so that we were able to put it back in the bottle. Maybe it was because of the dot-com economies and all the other crazy things that happened and change in our society technologically. But maybe we're there already. That's quite possible. I like to believe we still have a chance if we don't let it continue to go where it's going.
I'm going to make a pessimist of you yet.
You're I'm going to have a drink after this.
um, the next question I wanted to ask, and you mentioned the dot-com bubble, and I'm just wondering, what role should technology and innovation play in shaping the future of healthcare reform?
So when I really have to struggle and I have to find some substance to my optimism, this is it. It is the ability for new discoveries to change our understanding of our health, our lives, our existence, profound things that will. The Genome Project was a good example of that,
Yes.
where you start to unravel our very understandings of health and life and our place within it. It was the thing that created the American healthcare system. I said it earlier, were these discoveries around the ability to use anesthesia, which opened up a whole opportunity of how you could treat people.
Hmm.
You couldn't operate on people the way they did, screaming in pain, right? Instead, you could knock them out and do things. The germ theory of disease, the importance of taking care of people in an antiseptic environment, because that was what was killing them, not the interventions. And just a whole host of things. And we've seen the acceleration of these in the last 20, 30 years on the clinical front, where certain cancers that were just an absolute death sentence when you got them are now actually curable. And the people I know who are still alive because of that technology. Some of the diabetes management drugs that are now in play are just huge game changers for metabolic disorders, which are one of the leading trend things where people or insiders like me look at going, this is where we seem to be headed in terms of health problems, and we got to get that under control. So I believe that's our opportunity, is to continue to sort of discover ways to sort of reorient how we look at our health and our lives, with one caveat: the importance of trying to make sure that somehow that is, I would say, publicly owned. And I don't mean that in the stock market sense. I mean that it's not going to be controlled so much by some of these organizations that might be taking over healthcare or otherwise, that these are not solutions. They just become more barriers and more areas of conflict, because some people get them and some people don't, and there's no fair way to figure out how to deal with it. So they can't be tools for those who are not really looking to up the public's health. They need to be tools for us all to help us find the possibilities of the future. And I think there's something there. And even for whenever I conclude this series, I've been starting to build in this thing called the Institute of Life, and this is what they're researching. And I think I'm thinking that at some point this is where we're going to find the answers, and that it'll be such game changers. It's like almost like Star Trek healthcare, like, you know, Earl Grey tea hot, and for 15 cents, you're better.
Yeah, you are the optimist, aren't you?
I try.
How might healthcare reform impact small businesses and employers to provide health insurance to their employees?
Yeah, that's always been such a complicated topic because the small business community has kind of been sometimes captured by parties
Yeah,
that will sort of opposing any change. And but really what they're looking for is to deal with their employees on a way that would really enable and inspire their workforce. One of the creative things the Washington Health Fund did years ago to try to solve our funding problem, it was really a fascinating thing, but it didn't get enough money going. We became a broker and got commissions to try to help collect people and find solutions for their health that worked for them. And we actually did that for the small business community to try to really get in and figure out how can we construct wellness programs and things that practically would really make a difference. And we found a great opportunity to do real good there. It was never could never generate enough money to be our answer to keep doing the work,
right.
and stem the organization. But I think the heart of my answer goes to that. I think what we want to do is figure out how to get small business out of these political conversations so much and into how can we help develop things that specifically are about helping them be better serve and be partners and family members with their employees around their health. And it's a lot of the issues that everybody's struggling with, but there's a fabulous platform to do that. One of the participants we got in our governor's health bowl, for example, would be small businesses that would use it as a way to inspire their employees to be a team and somehow try to improve their health. It's that type of thinking. I think if we got there with them instead of these political fights, which tend to go into the right
Hmm.
left divide, I think we'd be better off.
That brings up an interesting point, and I'm curious, how can we strike a balance between personal choice and government intervention in healthcare reform policies?
Yeah, it's a hard one. Because you want both, and I mean, you really don't want government in your business. I don't think any of us really do, but at times it's sort of what you need to to protect your choice. And it's such a loaded word now. God, I remember when all that started, and it became a different word.
Yeah.
Um, I think it's part of us finding a civic balance, just about where we think the dividing line is in terms of our lives and our business, and where where government in particular should step out of the way. And we do have a long history in this nation of um, tending to say government should stay out of our business. So our line might be different than Canada's or many other countries, but I think we have to find that line and stick to it with a little bit better cohesion than some of the cultural fights we're having right now.
Yeah, no kidding. So much is focused on cultural issues, and we're not even, again, it goes back to the systemic problems from which
Yes.
these cultural issues stem.
Yes.
And which I guess brings me to my next question. What steps can be taken to address the disparities in healthcare access among minority communities? I mean, right now, so much of it is based on outcomes focused on race, ethnicity, socioeconomic status. What steps can we take to address some of these disparities at a community level?
Yes. So the most important thing is first you have to accept that they exist, which has been hard, unbelievably hard, in not just in government, but even with the provider community historically, because they're clearly do exist, and it's not just all an accident of that race or ethnicity. It's that there are patterns of care delivery that impact them that are part of the cause of that. And so part of the fight in my career was actually to get it acknowledged that disparities were core to understanding how to improve health. We had a saying with our Healthiest State in the Nation campaign in Washington, which was that we will not become the healthiest state in the nation unless we eliminate racial and ethnic health disparities. And it was all about changing the understanding of that issue. And I think we did some good with that. But I would go further than that now. I think the other thing, once you you can accept they exist, you have the opportunity to start to get data about it. And it's what I was saying earlier about if you look at the clinical community and you give them real data and real goals, they will get there. And would be really, you have to identify these gaps for them really clearly and saying, look, we have a disparity here, and the goal and the reward system, whatever it is going to be focused on eliminating that disparity. Because unless there's some genetic reason why this is there, there's no basis for it to be there. And so, but you got to give them all the tools. And even getting this data collected used to be a battle. It's changing now because we've got people to accept it's an issue. Now that we have a lot of that data, I think we can start to get to these clinically driven efforts to say that we want to see a difference in real numbers, that will change those, because we have to do that. There's no other way to getting to true health revolution in terms of our health status unless we address these disparities. They're significant and really deeply troubling.
Yeah, and no kidding. What are this kind of leads into things a bit, I think. What are the implications of healthcare reform on medical research and development? The technology that you talked about that brings you a source of positivity.
Oh, it is the discoveries themselves and just the incredibly bright people that are out there trying to figure out better ways to do things and things that we maybe don't even imagine right now. The problem is really how it fits into our capitalist system, and
Yeah,
if it's the ownership question around it, it's the if government supports it, what does that mean, and how does that flow through? It I guess most simply, I'd say it's sort of the ownership question about it, and the ability to diffuse it fairly through a society, if it's discovered and has its effect.
and what role do you think patient advocacy groups and grassroots movements play in shaping healthcare reform?
They've been important historically, especially the historic fights, just because it's been they've been the sort of the trench warfare in a battle that was being driven on the other side by a lot of money and a lot of inside politics and lobbying firms using cash and campaign contributions. Sort of
Absolutely,
there was
yeah.
a faction that didn't have that ability to generate money like that. All that's been changing some. And so these groups would be the grassroots groups that could go out there and sort of battle on the front lines. But that's also changed. It's getting, I mean, it's such the internet and social media has changed how you lobby so dramatically that I'm not sure kind of that even fits in the equation the same way it does anymore. I think the groups and what they're doing intellectually really continue to matter. Whether their historic tactics are going to be effective, I kind of question now, because I think it's just so overrun with everything from fake news to bots to you name it. It's
Yeah,
just not what it
yeah.
was.
Well, yeah, that's a tough one. In your experience, what are some successful examples of healthcare reform initiatives, either at the state or the local level, that could serve as models for broader national reforms?
Um, so I would start with, excuse me, some other nations. I finally had the opportunity later in my career to travel a bit and do some study missions and look at some countries across the globe and how they approach their healthcare compared to ours. And I was just struck by how important it was that almost every one of them that was functioning well had a place for everybody. And so they would have some public system that everybody was in, no matter their circumstances in life. And but almost in almost all these cases, the rest of their system was somebody could buy into something better and bigger or different. And what I saw on that was that the social cohesion was so much tighter than in the United States. The people kind of accepted that. They said, I can get mine. Maybe it's not the best, but I can get something and it feels okay to me. I would ask people on the street this question and they go, yeah, it's okay. Yeah, they can go there. It's okay. I'm not so focused on that. I have something. And it's that difference between the United States system, where this stark difference of the haves and the have-nots and the routes you go to get into emergency rooms and how difficult that's
Yeah.
getting. So I think that's one of the primary model things that's stuck in my head is it really streaks to the fairness question. How do you design something that's got a way to stick together? Um, I think they're really kind of aged now because of how far we've gone. But if you go back into the 1980s and 90s, there would be these community-based initiatives to try to bring all payers together into one set of solutions that would help kind of guide healthcare for a community as a whole. And even as part of that, the community might prioritize what preventive initiatives they might adopt collectively. Oftentimes, there were some of the leading industries that were locally based. Even they were large corporations, but they're still locally based, would be full partners in this, as are all the health plans, usually led by a blues plan in some way, because they were embedded in the community legitimately back then as a not-for-profit enterprise. And again, it was a collective coming together at the community level around health priorities for that community and how to invest money and how to have the rates everybody was paying be much more fair because they were compressed. Even if they weren't identical, they were at least compressed and not you
Yeah.
know factors of 20 difference. So there's a whole series of those that I look at, and I believe then, and I still believe, well, that if you want a model that we should move to, it's something more like that. I'm not even sure if that's possible anymore with the changes we've had, where so much of American healthcare is no longer a community thing because it's owned by these corporate conglomerates that look out over America from wherever their corporate headquarters are and sort of almost make sure they don't have a community representative because that's going to get too squishy and touchy feely. And, we don't want them involved in messing up our financial decisions. So those are some of the models I look to.
Yeah, and that's where I get depressed is in that the impediment of the corporations where the reform that you just talked about becomes almost impossible.
Yeah.
And I know that you can't answer this. I'm going to ask the question anyhow. How do we overcome that issue? What are strategies that we can use to really zero in on that core problem?
Yeah, that is a hard one. There's the general answer. Even as I say it, I say, boy, this doesn't work because we sort of live part of it. It's understanding that these corporations should not be driven as a matter of fundamental policy and governance by their managements. They should be driven by their boards. And so many of these boards have essentially abdicated the responsibility for the control and vision of the organization to their executives. And so my answer is actually get to the boards, have them start to take the leadership role in charting the path for the future, not have it be the executives who, unfortunately, in too many cases, not all, because I know a lot of great executives who really feel deeply about what they're doing, but some who are just in there to cut and run, get their best deal, cash out, and get out. And if the
Yeah.
organization goes to hell or doesn't serve a greater purpose, who cares? Um, that's what does not help. But the board should care. It is their communities. It is their thing. They should be on there because it's a civic duty, not because it's some opportunity to make some money or whatever it is. It's not kind of how certainly not for profit boards are supposed to be
Right.
structured. Maybe different if they're investor owned companies. That's why I have a tough time with more and more investor owned companies being in healthcare. But if we're talking about the historic pattern in healthcare, where they're mostly not for profit organizations, again, many of them with religious roots, others with community roots, get to the boards, have them accept their responsibility. And when I said I'm sitting here thinking about, I'm going back to Enron. Remember that whole problem?
Yes.
And there was a whole series of initiatives that were supposed to somehow make those boards more accountable and function as they should. And that was a complete debacle. In fact, I used to regularly swear when I was a CEO because I'd have to fill out these things for our auditors that were all about Enron requirements. And everyone like, why am I filling these out when all the other things that you should have done to fix the Enron problem were never done?
Yeah.
So this seems like punishment for caring. So, anyways, that's a digression. But again, I would go to the boards and say that's where we got to ground this. And there's some hope if we can get there. If we go to the executives, I don't have a whole lot of hope will change things. because they just come and go.
Yeah, that's a huge. Well, the revolving door is a huge problem as well
Yes.
in government, where you've got corporate executives coming and going in, from positions of government.
Yeah.
Um,
Huge problem too. I'd agree with you.
with the increasing focus on value-based care and population health management, how do you envision the future of healthcare delivery in the United States sort of evolving?
Phew. Well, that used to really be the model people would talk about, but we seem, for having done it for so long, to be doing it so poorly that it doesn't seem to work that way at all. And anybody I talk to about it, and in, in some of the places where it was being done are no longer because they're now part of some other corporate enterprise.
Right.
Except Group Health Cooperative, Puget Sound, your Washington roots. They're now part of Kaiser. I haven't really looked at them closely, but I don't know if it's better or worse. But my own fears would be that that was a really great population-based approach to trying to improve health. That way back when I worked at, and was really proud to be a part of it. I just can't imagine it's working the same way now. Maybe it is. That'd be great. But I just use that as an example. There's so many of these initiatives that I remember seeing start, and I sort of question where they are now. The ones I see don't really seem to be that. They seem to be sort of dressed up to market themselves as that, but I don't see the squeeze and the juice.
Yeah. One of the things that I love about the Everett Clinic, and we talked about this earlier, when you go into a doctor's office and you only get like 8 minutes with the actual doctor, if even that. One of the things about the Everett Clinic that I still love, and I'm fearful this may change now that they've been purchased by this conglomerate, but every doctor that I have at the Everett Clinic, there is no there doesn't seem to be a time limit on patient care.
Huh.
I've had the doctors stay with me for 30 minutes at times. There's not a sense of being rushed or anything, and
Hmm.
that kind of
Interesting.
goes. I mean, that again, I'm afraid that that's going to change. And some of the doctors I've talked to have said that there is increased pressure to limit patient time. But the doctors do seem to have a lot of authority in deciding how much time each patient requires. Do you think that that's a sustainable? Is that a sustainable model of healthcare?
I think it is if you create a consumer movement where the expectation demand is a better consumer experience. That 8 minutes is not enough in almost all
No.
cases. And what you find is, I certainly find this personally, when I figure out how to extend it into more like a 15-minute conversation with my physician about real things that really actually will help me understand kind of what's going on with my own health, I feel good about it. The 8-minute ones, I walk out going like, well, that was a freaking waste of time.
Yeah.
And if that starts to become something that matters in the transaction of healthcare, whether it's politically or financially, and we start to govern that, not corporate executives saying we figured out you only should only have 8 minutes to do what we care about. Well, screw you.
Yeah.
This is what I care about is an organization that's going to sort of give me what I want. If it's not that, I'm going to check out. And if I have the power to do it, I will.
Well, and that's the thing too. I mean, if you want to focus on preventative care, you
Yes,
can't do that in an 8 minute session with a doctor.
precisely. Yes, which is what I care about. Yeah,
Yeah.
maybe if I have something where I care about other things, but yeah, you got to dig deeper. It's not simple. It's not.
Well, another issue too that I know that doctors are facing is the increase in administrative burdens that come with being a doctor.
Yes,
My doctor, for instance, spends a lot of time with patients and was getting to a point where she was overwhelmed with having to do like the notations and the documentation. And so what the Everett Clinic did is they actually gave her a medical transcriptionist that follows her into patient rooms and does the transcription work, cutting down on her administrative burden. And I thought that was a very creative solution to a problem that we don't really think about. We don't really think about the pressure, the we don't think about the behind the scenes action at the doctor. We don't
right.
think about what the doctor goes through and the administrative hurdles they have to face. Can you speak to some of that, given your experience in the healthcare field, some of what the doctors actually go through?
Yeah, no, it's a tremendous burden and certainly advanced humongously over my career. What I would say, if we have a good healthcare system, we wouldn't have to do so much of that. That some of it would be automated, some of it wouldn't be unnecessary. It's all that is sort of backdoor dealing with the enormous complexity of a
Hmm.
system that is so fragmented and doesn't stick together very well. So the notion of having a solution where you get others to help the people who are supposed to be doing the real work to do their job better, that's as old as industrial development of trying to find solutions like that. And it's just as one of the best solutions for the American consumer is that everybody should have their own personal navigator that will help them select their insurer, figure out how to use their insurer, figure out how to deal with the systems, including the transcriptionist for the doctor. And it wouldn't be necessary if we had a system that really worked well, but we don't. So what you see, it's one of the inefficiencies of the system, but it's also the solution. Is you need these backdoor solutions to somehow rationalize a system that doesn't hang together at all.
Yeah, absolutely. As someone who's very positive, a positive thinker.
I was before this interview.
I'm sorry. I'm sorry. I was just wondering, what advice do you give to individuals who are looking to make a positive impact on healthcare policy and reform within their communities?
Um, with a lot of students over the years, and I mostly try to tell them to approach it as a matter, find their values about it, find what they believe in, and try to approach it with sort of their emotional side, because the rational side will kind of go crazy looking at it as it is. And find your heart to, if you're passionate about doing good, of which many of them are, especially students, when you get them so young and sort of wide-eyed and open for the possibilities of the future, sort of find that and sort of embed that and let that be your guiding force, not necessarily what you're going to see in terms of experience and even job opportunities. And says, be careful of job opportunities that will take you too far off what you really want to do.
Yeah, following the money.
Yep.
Yeah. How do you think, and I'm wondering if what inspired you to write about COVID in particular? And how do you think the COVID pandemic has reshaped our understanding of the healthcare system and the need for healthcare reform?
Well, I had to write about it just to get it off my chest because that whole period drove me crazy. One of the things I brought to Arizona when I took the job down here was a collective way for the hospitals and others to work with the state to plan for major disasters in healthcare. And what we've all known, I've known this for most of my career, that a pandemic was coming at some point. I knew all about the 1918 one. I was involved in some of the scares along the way. We knew this was actually one of the major risks, along with airline crashes and a number of other things that were not just a question of if, but more when.
Right.
And so, and there were plans, and we had things and great ways to deal with this, and there are things that I knew about at the federal level that were ways to really get ready for something that might come. And then it all happened, and everything just went to hell in a handbasket. And while some of
Yeah.
those plans, even the one in Arizona, was somewhat used, a lot of it was just became a whole new script based upon craziness. And it drove me nuts. I wasn't really intending to retire when I stepped out of my last job in 2019. I was going to just take a little time off and then figure out what I do next. And then COVID happened, and it was like I don't even know how to re-enter that crazy world. So I was sort of on the sidelines having to watch it and talk to former colleagues about it and swear at the TV. And
Yeah.
so part of the COVID piece was just getting some of it off my chest. And I try to be balanced about that. But what I really wanted to get at once I calmed down, because as soon as I wrote a little bit, I felt better. Um, and COVID seemed, it wasn't as bad as it really could have been. I mean, proved to be a lot more tame than it was initially threatening to be. So I started to turn my attention to the other thing that was starting to trouble me, was seeing how it was changing the healthcare system. One of the big things I talked about earlier, which was it sort of provided a screen for this consolidation and this quest for money to grow among these corporate entities. And so that was troubling me. But the other thing that really troubled me was seeing the emotional toll it was taking upon clinicians, some of whom I knew, some of whom I was related to. And it was first just how heroic so many of them were in
Yeah.
stepping into the breach, as most of us wouldn't, into places to deal with this disease that could kill them, to go take care of people that needed them. I mean, the oath of what they did, and they stepped in and did it, and it was like, wow, that's impressive. Sort of a moment of reckoning, like on the battlefield, who goes over the wall, and they
Yeah.
did. And then see how some of them were attacked when they'd go to the grocery store in their scrubs and would be attacked by this ideological group of people who decided they were the enemy. And I just thought it was, how disheartening could that be for them? Um, it was like the troops coming back from Vietnam,
Yeah.
right? This is just so uncivil, at just at its base, and so it really troubled me. And I found a lot of people who just got sort of disgusted by the whole thing, and it sort of took a lot of um, energy, positive energy, out of the system in terms of the workforce. And I think I still see residues of that haven't left, and worry that that's just going to be with us now in this new war of culture wars in America. So that's the part that really troubled me, is that our inability to even agree that this period happened and who was on what side, and there's bad people in the system trying to kill people. It's like, these are not the people I know and worked with for 40
Yeah.
years.
What could we have done differently during COVID? Some of the some things rather.
Well, mostly we would have accepted basic public health practice. And yes, there are all sorts of mistakes made, huge mistakes, included by the CDC, about testing. That really contributed a lot to this. But just basic public health practices, that we know if things are contagious, there are certain things you do to limit the possibility, even if you can't prove that's the case. So right off the bat, we could have really done a whole series of things just to mitigate the problem. We wouldn't have eliminated it, and we're in a much more mobile society than we were in 1918 when that hit. But even just having some sense of history and understanding how quickly these things can move around from people to people, especially if it's an airborne infection, there are things that could have been done that were fought in 1918 too. And I thought we might have learned from that experience. The communities that continue to hold parades in the face of the 1918 pandemic, and all sorts of people died from those parades. We just kind of said, oh no, that's all imaginary. And so, again, and we could have learned, and then it would have been much more normal process that, well, we were doing this because we had to make sure, now we see that we actually don't need this, right?
Right.
And that's some of what happened. But once it got into the circus, and it just turned into a total circus.
No, yeah, it circus is putting it mildly. Um, do you think that COVID prepared us for the next pandemic that's coming? Do you think we learned any lessons?
Unfortunately, I do not. I see us
Really?
worse off than we were before then, because now we have these groups that are fundamentally saying vaccines don't work, and that this vaccine is dangerous. And I said, I've had a lot of experience with stuff. It seems to me to be one of the safest vaccines we've ever developed. But meanwhile, whenever I say that, I'll get 65 emails about how they're sure that it's killed like thousands of people. And we're like, that's why I don't see us being better off. I see us being worse off. It comes back that it'll almost immediately sort of fit into the talking points that were generated to say, oh no, this is all about government control, or whatever it really was about. I don't think I ever truly understood. And I think we'll just sort of see all that sort of parroted back again, because that's what we learned, is that we can resist and make havoc over an issue that threatens to kill millions of people. Sad.
It is. Do you think there's another pandemic that's around the corner that's coming?
Again, it's when, not if. I'd like to believe it's far off. We've been Somebody connected to the public health community. We've been troubled by those live markets in China for a long time. I was in
Yeah.
China for the SARS, so do I believe it's just out there is a possibility. Absolutely. I hope it's far off because, again, I'm not too convinced of our capacity to deal with it again, um, especially here in the United States. I think across the globe, maybe.
Do you think it would
No,
collapse the entire system?
I think that actually am pessimistic about. I do think there would be a good chance it would. I just
Wow.
don't think we can cope with it, given what just happened.
What can we do to prevent this, do you think?
I think it's going to take some time to get some trust back in the public health community. I hope our incremental policies take us that direction, not the other, because I mean, we talked earlier about a potential Trump presidency. Some of the talk of that is, well, the CDC would lose even more funding and credibility, I would assume. As much as I can be very critical of the CDC, that would not be a good development in terms of our preparation. But I think we needed to, before the pandemic, invest more in our public health community.
Yes.
So much of it is more grant funded around particular things and the core functions of public health that we were already failing on that front, despite there being billions of dollars committed to it in the Affordable Care Act that was later siphoned off for other purposes. We need to bring that back. We really do need to rebuild our public health infrastructure. If I may go back to that 1932 report, one of those 5 recommendations from that group back then was to really invest in our public health system. And so I think we're actually at another moment like that after COVID. And so many people that have stepped out of public. I have a lot of friends that just got out of that. They just said, I can't do this anymore. I can't be, being attacked in my community for trying to stop people from dying. And
Yeah.
they gave up, and they were wonderful leaders, brave leaders who just said, enough is enough. I can't do it. We need to rebuild that. And we're not, I think we've got years to go before we'll be ready for another one without doing that.
Well, as usual, we're running out of time on the show, and I didn't get to a lot of my questions. So I guess I want to ask you, most of all, looking ahead, if you could envision any system that you wanted as the ideal state of American healthcare, what steps do you believe we could take to get there to achieve that vision?
So the sort of idealistic model and politics
Yeah.
not getting in the way.
If
Yeah,
you
I would approach it as a matter of the federal government has the resources to provide the bulk of the financial resources to promote health in states and localities across the United States. And then it would be allocated not to states, but on a regional basis to try to, again, force its way out of the current status quo at the state political level and the community level in some cases, but really try to get mostly the money flowing to the community level to the types of organizations we talked about earlier that are more collaboratives of community leaders, business, public health community, the healthcare community, other interested leaders that are going to come together and try to make decisions for that community about how the money will flow, how investments will be made in healthcare and healthcare technology, and how it sort of will govern itself locally, and let the thousand flowers bloom across the United States. Again, with the federal government putting in most of the money, with dual goals around it that would target preventive health patterns to make sure that is embedded deeply into the new system. So it's much more about a wellness system than a sick care recovery system, and see where we go with new technology being able to take those ideas and water the blossoms into a great new future.
And now let's go to a pessimistic view for just a moment. How likely do you think that vision is?
Oh, that highly unlikely. I can't imagine it happening, looking at the world as it's constructed now and the
How long
financial
would it
barriers.
take to implement, do you think?
If you had a blank sheet, you could do it in a couple of years. I mean, it wouldn't be
Really?
have full force and effect. Yeah, but it's sort of the taking apart of all the current interests and the status quo elements. That's why it's almost impossible, because it's not a question of how long it's just you can't. It would be so resisted, legally and otherwise.
Do you think that we'll ever see in the United States, at least in our lifetimes, a Medicare for all type initiative that actually takes off?
I do, because it's
Seriously,
just
really?
yes, I do, because it's just too practical an answer to be ignored if things get so bad. So now I'll go down your pessimistic road where we really do start to lose confidence. I do think we start to get to a point, if there's a takeaway of Medicare and things like that, where people will react the other way and say, no, this is a sacred program. Let's build our solution on something that is a sacred program. And again, if it's a choice model, as opposed to everybody has to do it, that's the key to it. Then I think you find people say, oh, if it's there, and they'll go to it in droves and stay there in droves and maybe even bitch about it in droves, but it will be theirs.
Greg, thank you so much for joining us today. Let's go ahead and plug your book, and where can people find your book?
Yeah, my books are on Amazon. You can just go, my author name, Greg Vigdor. I've got an author website. There's also a page in the Washington Health Foundation website you can find where I do a video and talk a bit more about the books, although we talked a lot about them on this show. The Amazon's the easiest place to go, and encourage people to take a look at them. If you read it, write a review. I'm really trying to learn from others about what I should write about and what I should say. So it's a great opportunity and privilege to be on with someone like you and your listeners.
Well, thank you so much for joining, and I'm really enjoying the book, and I can't wait to finish it. And then I'm going to start on the theory of Irv. I should have started with. I'm kind of going back a bit here, but
yeah, I think you'll
really
like the theory of Irv. It's I've been told by some people it's one of the easiest read on American health policy history that anybody's ever done.
Well, I'm looking forward to it. Again, thank you so much for joining us. And please check out Greg Vigdor's books. Go to Amazon. The Theory of Irv, we have up on the screen now for those who are watching. And we've also got the COVID murders. If we can put that up on the screen, there we go. Another health policy detective story. That's the one that I've started to read. Enjoying it very much. I think I want to thank you for writing books that speak to the problems of American healthcare, because I think you're doing something in a fictional environment that is having tangible impacts in the real world. And so I want to thank you deeply for doing that.
Yeah, much appreciated.
And again, thank you so much for joining us. And please check out the COVID murders. Hopefully there'll be a movie soon version of it.
Yes. And Sean, go whip COVID's butt.
I'm going to. Thank you so much. This has been Coup Save America. We'll see you guys next Tuesday.